very much, Caroline. After lunch, I suppose it's only fitting that the first section here should be talking about food. Caroline talked before we went into lunch about how the food was all local. It's quite a healthy lunch. I quite enjoyed that. And technically, from a public health perspective, I'm here to tell you that if you eat at least 20 of those cakes, that's one of your 5 a day. So there were still plenty downstairs when I left, so I don't know whether we can get people eating them all later, so that's great. So my task here is to give a broad perspective on food and health. I'm also conscious that we're in a session that's headlined up joining up some fragments, so I'm going to try and do a little bit about that. I'm going to try and tell you a bit about the Food Futures work that we've been doing in Manchester for the past 10 years. Not sure whether it's a local experiment, but I'll come on to that. And then maybe try to finally take it into some of the connections into the local economy. I'm going to try and do that fairly quickly, because actually I'm much more interested in hearing what the two speakers after me have got to say than I am in hearing what I've got to say. So let's see how it goes. Right, so to start off with, if I've got to take a broad view on food and health, let's start with what's the narrow view. If you think about food and health generally, you're going to come up with stuff like we've got on here. There's food safety, salmonella outbreaks. You've got the eat well plates, trying to get people to eat their 5 portions of fruit and veg a day, cut down on fats and sugars, etc. You'll always get stories coming in on the news. Drinking coffee might fight colon cancer. Last I heard, it caused pancreatic cancer, but I'm never quite sure about these things. Top 5 cancer-causing foods, massive amounts of this stuff. You've got top 14 anti-cancer superfoods. There's a lot about what you're actually eating. It's about your diet, what you're putting into your body, and what that does to you. That, in my view, is important, but it's a very narrow view of food and of public health and food. If you look at today's topic about prosperity, the connection between public health and food and prosperity, there's a narrow view of that as well. Again, regular headlines, how bad diets can cost the NHS over £2 billion. Bad diets are a drain on our economy. Unless, of course, poor diets cost the NHS £6 billion a year. Figures pulled out of the air. Just out of interest, the answer to that question is that if you're trying to demonstrate the value in economic terms of the work you want to do on food, then it costs £6 billion a year. Another bit of the narrow view of food's links to prosperity. Anybody guess what that is? It's Tesco's pre-tax profit takes over the past few years. There's quite a lot of stuff about the link between food and prosperity that are about the traditional economic development models and companies taking in quite a lot of cash. Sure, that lot's all very important. As a public health professional, you'd expect me to look at diets and look at healthy diets. An analysis that was done by Foresight a couple of years ago, very influential, looking at obesity, predicted that by 2050, 60% of the UK population could be obese. That's got an enormous impact on our health and well-being. The potential for making savings and for saving lives through tackling obesity in that way is very significant. What are we doing wrong with our diets from a narrow health perspective? I could go on for hours. Never mind your 14 cancer prevention superfoods or whatever it happens to be. Basically, we need to increase our fruit and veg consumption. We need to reduce our salt and fat and sugar intake. It doesn't get much more complicated than that from a dietary point of view. Some analysis has been done suggests that if we manage to do that, get it down to right levels, we could save about 70,000 lives a year in the country. Manchester level, that's probably about 500, 600 lives a year, just from dietary interventions and changes to that. But the impact of food on health goes much broader than that. If you look at the way food works at the moment, there's classically been, in cities, there's been a food chain. I mean, Caroline will probably recognise some of this. These are taken from presentations that I first did when we launched the Food Futures initiative 9 or 10 years ago. So this stuff is still the case. You've got agriculture and food production mainly outside the cities. It's processed mainly outside the cities. It's then distributed into the cities, sold in the cities, eaten in the cities, and any waste products go out of the cities again for disposal. At each part of that food chain, there are impacts on health. Agriculture and food production is a very significant part of the environmental agenda. Food chain contributing about 18% of greenhouse gas emissions, farming a very significant part of that. Meat production is another, land use efficiency and other foods in particular. Is carbon dioxide a public health issue? Of course it's a public health issue. It may not look like one massively in Manchester. Climate change does have a big impact on Manchester, who knows? But there's 10,000 people dead and 700,000 homeless in the Philippines at the moment, who will suggest to you that climate change is potentially a significant public health issue at a global level. Everybody in the room will know about this. We've got real world price rises. Prices have been going up very dramatically since the 1990s. If you look at the bottom graph here, the significant thing about this graph to me is what's going up most: fruit and vegetables. So in an environment where what we're trying to do is encourage more and more people, particularly people on lower incomes, who tend to have the least good diet, to eat better, eat healthier, eat more fruit and veg, the entire economy of food is driving them in the opposite direction. Fortunately, there are ways in which you can start to join up some of these different fragments. Because if you look at what it takes to have a healthy diet and what it takes to have an ecologically friendly diet, broadly speaking, they overlap. I think there's probably a little bit of a challenge in terms of oily fish, where in health we would probably tell you to go out and eat lots of oily fish, and environmentalists will probably tell you not to go out and eat lots of oily fish. But other than that, we're probably on much more or less the same page. This is a piece of work that was done a few years ago in Scotland that looked at the impact ecologically of different diets. So the bars represent the total footprint, global hectares per person, that it takes to have particular diets. A standard Scottish diet being in there about 0.75 hectares. If you just make it healthy, by which they mean more fruit and veg, basically, it drops it. If you make it healthy and local, it drops again. Vegetarian drops again. Healthy local vegetarian takes it down that stage further again. But there's lots of connections in to the way that we can join up our attempts to have a healthy food system with our attempt to have a sustainable food system. They work very closely together. And when you get into a little bit more depth about that, what is it that causes the standard diet to have such an enormous ecological profile? It's that big blue bar on the end there, it's meat. If all that you do is make the diet healthy, which does reduce meat consumption, you don't have to go vegetarian for some of this, it drops considerably, and indeed, the order of this has changed. That's now meat, and that's fruit. So you can make a significant difference just by looking at one or two parts of the dietary system. So in Manchester, about 10 years ago, I was asked if I would start to write a food strategy, a food and health strategy for the city. I discovered at the same time that there were people within the city council, which I wasn't a part of at that point. I was connected through to that. But public health was still outside the city council, who were doing work on food policy for the city. So we came together and started to look at a complete holistic approach to food in the city and what we wanted to achieve. And we set this vision, which has been the same really for the last 10 years, of trying to create a city in which access to fresh, affordable food is at the heart of local communities. We've heard this morning already about the importance of keeping money flowing within local communities. So a critical part of getting access to food locally. Where local food production and distribution are common, working in the local environment. Private retailers and the public sector working in partnership. Obviously, if you look at food and health The government pushes a choice agenda, they say, and so in the supermarkets, they say what we do is we provide people with choice and we respond to demand. You can argue with that, I do, but significantly, we do want the place to be a place where people choose a healthy and well-balanced diet. People enjoy their food, and where food preparation is safe and hygienic wherever and wherever people are. A colleague of mine from the Environmental Health Department was instrumental in setting up Food Futures, and she wouldn't let us get away with not doing that, and doing it. So, you remember this slide, this is the way the old urban food chain was. What we've set up in Manchester through the Food Futures programme in an attempt to move on to something that accepts that we will always have a bit of that food chain happening, but says you can relocalise some of this and you can have an urban food cycle within the city. There's maybe not a lot of scope for agriculture within the boundaries of the city of Manchester. There's quite a lot within the boundaries of Greater Manchester, perhaps. You can process things, you can add value locally, you can distribute locally, you can dispose of food locally. We've got some fantastic work that goes on at the wholesale market here, where they take all the food waste from the market. If it's still edible, they try to grade it out and get it back into the food chain. If it's not, it gets composted and can get reused that way. So the Food Futures programme that I'm involved in is trying to take steps that encourages each of these points of the food chain to happen and to be recycled within the city. Are we succeeding? We have some really good examples of work at all of those levels. Have we revolutionised things in Manchester? No, of course we haven't. Is this an experiment? It probably is an experiment, but if it's an experiment, it's not a very good one academically. We don't have very good outcome measures. We know what we want to achieve, and we've got some indication that some of those things are going well. We've got some good food growing programmes locally, but they tend to be small scale community development initiatives. We've tried to support some food processing. There's lots of work that's going on that. What I think we've been really trying to do is change the whole culture of how food is seen in the city, particularly within the community and voluntary sector and within the statutory sector. When we launched Food Futures 10 years ago, it was at a small workshop seminar. There were 20 people there. When we launched the Food Futures strategy properly, it was at a conference with 200 people. There's now more than 350 people on the mailing list that we support. And an enormous number of community organisations and community groups have sprung up and have been supported and have started to do their own thing around food. And it's absolutely the way we want things to develop. But the other thing about this urban food cycle, of course, is that there are points within each of these with potential economic benefits. People can be doing things themselves, they can save money through this, they can generate business through some of this. So there's scope for economic prosperity coming through this system. If you look at what prosperity means, every time I do something like this, I start off by looking in the dictionary. What does prosperity actually say in the dictionary? Actually, the word wealth comes in there sort of second from the end when you read the dictionary definition of prosperity. It's about flourishing. It's about things feeling good, people feeling good. That's what prosperity is about. When you start to talk about flourishing, I look at it from a psychological point of view as well. We use that word in the sort of mental health and mental well-being sense of people who are able to achieve, able to do what they want, who feel good, who feel complete. And that to me is what prosperity is all about. Ironically, of course, public health tries to do this. You get people like me who come into public health from the point of view of wanting to make life better for people. We want to make people happier. We want to make the environment better. We want to drive things forward. Public health has always actually been about economic development. It's just that people like me who are employed in it don't think so. Right back to the early days of the pioneers of public health in the sanitary reform era, you had the do-gooders like me out there trying to do our public health work. It was actually being funded by governments, local governments, and industrialists who were sick and tired of the fact that none of their workforce were able to work hard because they were too ill. And you can't make money if your workforce is ill and dying. That's one of the major reasons why governments invest in public health. Oddly, the other, historically, is that they discover that their young men aren't strong and fit enough to go off into wars. That's the other reason that governments fund public health. But, so public health has got this long history of engagement with this sort of work. But there's a lot more that we can do. And that's the broad view of public health and food. And I'm very interested to hear how we can actually revolutionise the food system. And I think that's probably the role for the next speaker. Thank you.